I might suggest that a better name for this exercise is hip extension eccentrics, but we tend to name exercises, especially eccentrics, over the primary muscle involved. In this particular case, the patient is in prone or quadruped, and the partner is assisting with a concentric component. With this exercise, I would tend to, as a clinician, be over here. And it's less awkward, and the other thing is you can help control and keep this pad down in a good position. Obviously, you can do these in a standing or upright weight-bearing position, but there are advantages of using this in this position. To understand this better, check out our website at rehablearningscenter.com and check out our courses. Take care.